Okay, ready for a deep dive. We're talking metaverse today, but, and this is wild, it might involve like a virtual vaccine.
A virtual vaccine, huh?
Yeah. Have you ever thought about the metaverse and like increasing vaccine confidence?
It does sound pretty futuristic, but there's this research paper. It's called Toward a Meta Vaccine Future,
Hmm.
and it makes a pretty strong argument.
I know, it really surprised me. I get that the metaverse is for more than just like, gaming now, but this whole like meta vaccine future thing,
Yeah.
that's a whole other level.
Right. It's a really interesting intersection of two big things that are, happening right now. We've got, the metaverse is blowing up, and then we have this very real problem with, vaccine hesitancy.
Yeah.
And they really go for it, these researchers, Nawaz et al. They don't like beat around the bush about the problem of vaccine hesitancy, They even break it down into like different levels. So it's not just like a yes or no kind of thing.
Right.
It's more nuanced than that.
Yeah, for sure.
And that's where the metaverse gets really interesting. What they're saying is that the metaverse can kind of address these different, levels of hesitancy. And it can do that by using these like very personal experiences, which is something that traditional methods, don't always do very well.
That's a really good point, actually.
Yeah.
Because it's like, what can a pamphlet really do? You know what I mean?
Exactly. Yeah.
But imagine like someone who's, maybe a little hesitant about vaccines and they can actually experience, but like virtually, what could happen? Like the consequences.
Yeah, for sure.
Both good and bad.
Yeah.
And the researchers actually call this digital twins, which, I don't know, it sounds like something out of like, sci-fi.
It does. But if you think about it, it's kind of like a flight simulator.
Okay, yeah.
But for your health. And you could use this digital twin to make these like choose your own adventure things, that really show you like, hey, vaccines are important.
Yeah.
And it just makes sense, It's like we always say, seeing is believing. Right.
Yeah. Like I could read about vaccines all day, but if I could actually see it, like in the metaverse where I'm actually there, that would be way more powerful, way more convincing. And I bet, like, especially for younger people, they're already in the metaverse.
Right. The researchers actually point that out, that this could be really huge for young people.
Well, yeah, because it's like, it's normal for them, right? Like they're already there anyway, spending time with their friends and all that, learning. So why not like meet them in the metaverse with this information?
Exactly. That's the idea. And the thing is, it's not like a lecture, right? They're already used to like avatars and all that. So it's not like, another boring PSA. It's just part of their world.
Yeah. It's like, you're hanging out with your friends in the metaverse and, oh, by the way, you're learning about vaccines.
Exactly.
But really, I think this could help people, feel better about vaccines, like more trusting.
Absolutely.
Because it's not just, here's the information, kid.
Yeah.
It's more like it's a conversation.
Right. And the paper talks about like you could have virtual support groups.
Oh, wow.
Where people can talk to each other, or even like simulations of how they make vaccines.
Oh, that's cool.
So you can really see all the work that goes into them and how safe they are.
Right. That's huge.
Yeah.
It almost makes you forget about all the like, well, what about the other side of it?
You mean like, are there any downsides?
Yeah. Like, it can't all be perfect. Right. Like, what are the challenges? We can't have a deep dive without talking about the challenges. And the researchers do talk about this. Like, not everyone has access to the metaverse yet.
Right.
So that's a big one.
Yeah, they talk about how important it is that everyone has access to this technology because otherwise it's just going to be another thing that leaves people out.
Exactly. But also, like, what about misinformation? It seems like every time we get a cool new technology, misinformation is right there with it.
That's definitely a concern. But they had some ideas about how to stop that.
Okay.
Like maybe, like working with the, the social media companies to set rules for what kind of health information is allowed. And they also talk about like checking to make sure the people giving you information are, real doctors and stuff.
Okay, that's good. So like some kind of quality control for the metaverse.
Yeah, exactly. But it's not just about the information, right? There are things about the technology itself that can be a problem.
Oh, right. Like getting sick.
Exactly. Yeah. They talk about, headaches.
Yeah, I've heard about that.
Dizziness, eye strain, all from using the headsets too long.
Yeah. Not a good look for vaccines.
Right. And what about long-term effects? We don't really know yet, especially for young people. So That's something to think about.
So it's like we're about to do something huge with this whole meta vaccine thing,
Yeah.
but but we had to be careful too.
Yeah, for sure.
There's still a lot to figure out.
It's like any new technology.
Right.
It has so much potential, but
Yeah.
we have to be smart about it.
Totally, totally.
We don't want to just jump in without thinking.
Exactly,
Realize
exactly.
the consequences.
Yeah, and even if this whole meta vaccine future is like way in the future,
Yeah.
this paper still made me think differently about public health.
Oh, absolutely. It's so innovative.
Yeah.
The way they're thinking about using technology
Yeah.
to solve these really complex problems.
It's not just about the technology either, right?
Exactly.
It's how we use it.
Yes. It's about connecting with people,
Yes.
building trust.
Yes. Making sure people feel good about the choices they're making.
That's it. Informed decisions.
Yes.
And that takes everyone working together.
Right.
It's not just on scientists or tech people.
Yeah.
It's policymakers, healthcare workers,
Yeah. Educator.
the public, everyone.
We're all in this together, right?
We are.
But wow, like when you think about what the metaverse could do for public health,
I know. It's pretty amazing.
it just blows my mind.
This research was about vaccines, but
Yeah.
think about all the other things we could do.
Oh my gosh, yeah. Like what? Give me an example.
What about healthy habits? Could we use the metaverse to help people
Oh, well,
eat better, exercise more?
yeah.
What about mental health support?
Oh, yeah, that's huge.
We could reach people in a whole new way.
Right.
Provide support, resources.
And what about like
yeah,
training doctors and nurses?
exactly. Virtual simulations,
Wow.
hands-on experience.
That's the real meta vaccine, maybe.
Maybe it is. The innovation, the collaboration.
Yeah, it's about thinking differently.
It's exactly.
Finding new solutions.
And working together to make them happen.
Well said.
It's been great talking about this with you.
Yeah, this was a really cool one.
I'm really excited to see where this all goes.
Me too. And to all our listeners, we hope you enjoyed this deep dive into the metaverse and vaccines and the future of public health. Keep those metaverse questions coming. We'll be back soon with another deep dive.